Located atop a slope in a forested area above Lanai City, from a small clinical space that was converted from a 3-bedroom, 1920s era plantation home, the Lanai Community Health Center provides care for the island's 3,000 population by directly providing health services. Services include primary medical care, dental care, behavioral health, prenatal, family planning, nutritional and preventive health education. The health center's special focus are on individuals who live below 200% of the federal poverty level, nearly 40% of Lanai's population. To better serve Lanai, the health center is seeking to raise funds to open a new 6,800 square foot facility within the center of town. The new facility would better suit the community's needs by including medical examination rooms, consultation rooms, clinical laboratories, dental exam rooms, and administrative support space. It will also include an activity multi-purpose room to be utilized for joint programs with the Lanai Arts Center, flu clinics, women's, infants, and children program activities, and health education events.
The health of Lanai as an island is really on the precipice of becoming a literal desert, or returning to the tropical vibrant Hawaiian island that it used to be. What the health center is really trying to do is to change the culture of Lanai so that we begin to think of health not as something that happens to us, but really something that we can choose to choose the quality of. One of the issues that the health center has to deal with creatively is the sort of geographic isolation of Lanai. Many of the specialists that people need to see is on neighboring islands. With a larger facility, the community health center would be able to provide more services, and fewer of those services would have to be sent out to outside providers, which would be a big boost, big help for our community, seeing that many elderly patients and disabled patients here in the island already have trouble traveling by themselves. Another difficulty that the health center has to contend with is, even though we live in a small community, or perhaps because we live in a small community, distance becomes difficult. Many people here on the island simply walk to where they need to get to go. And because the health center is sort of out of the way, up through a hill, sort of almost in the woods, people on the island have a hard time finding it. If we don't build this new center, Auntie Phyllis's vision of a community health center, of something that's really centered and driven by the community, by individuals and members of the community, I don't really see it happening. So this facility really is something that we need your help with, and this facility is really something that we need your help with.